Well, hello and welcome to Rajat TV. You're watching India Fights Back with your host Rajat Kain. Well, this is a show that gets you latest on how India is fighting the COVID-19 pandemic and what's happening across the world vis-a-vis this pandemic. In this edition of the show, we'll take up a very important issue of a new strain of SARS-CoV-2 virus or the COVID that has been found in UK. This new strain has alarmed the health and civic authorities across the world. With its rapid spread, UK authorities have introduced a set of strict restrictions on mixing, or to say on meeting or having a public gathering on the occasion of Christmas. That happens to be a major festival in England, Scotland and Wales, and of course in several other countries. Now, other countries too are alarmed and have already declared a travel ban to and from United Kingdom. Early in the day, the Union Health Ministry too called a meeting in New Delhi of its top advisory body to discuss the new strains of the novel coronavirus. Union Health Minister Harsh Vardhan has so far maintained that government is alert and there is no need to panic. It's important to understand that virus does change its characteristic, but this new strain happens to be extremely alarming for its fast spread. So how important it is to understand this new strain and how careful we need to be in the days to come. To discuss more on this extremely important issue, we joined with Dr. Raman R. Gangakherkar from ICMR. Many thanks for joining us, sir. Dr. Shahi Jamal, he is a very well-known virologist, and Professor S.S. Wasan from CSIRO, Australia. Well, many thanks for joining us. Let me start with you, Dr. Kherkar. Sir, given the initial reports, how alarming do you see this new strain happens to be? Of course, it's currently, the extent of its spread is reported primarily in UK, but how important it becomes to understand this new strain, sir?
Yeah, I think every information that we get is going to be useful when we fight against COVID-19. At the same time, we must remember that we should not panic at identification of one strain. It's not very clear as to on what basis of data are they actually saying that it is highly transmissible. Now, it is possible that they might have done lab studies to show better infectivity that is associated with this strain. However, to translate it into human beings perhaps is too premature at this point in time. However, knowing that it is being seen in UK, it is also seen in some parts of Europe to small extent. It's also seen in Australia. And we know that the South African one hasn't evolved as much. No, and it has not even moved outside the country. So I would say that we need to be cautious, but not panic at this moment, because it doesn't appear to be one that should threaten vaccines by any means.
Okay, right. So of course we need to be cautious to begin with, considering it's still early days and it is under study. Dr. Shahi Jamal, let me ask you a fairly, I would say, an academic question. Is it a normal phenomenon for a virus to have a strain? And how often do we see a strain of virus that now has been termed by, so far only by UK authority, as something which is spreading at an alarming level? So,
well, first of all, I don't really think it's a new strain. It's a new variant or maybe a new isolate. We don't know enough about the phenotype of this virus to really call it a new strain. As far as we know now, there are 23 changes in this virus compared to the original virus that came out of China. However, the virus has continuously evolved. The virus has acquired mutations. So don't be alarmed that there are 23 mutations in this. There are actually only 2 or 3 key mutations. And the important thing is that there are three key mutations that have come together for the first time. One is in the spike protein at position 501. The other is again in the spike protein at position 681. And the third one is a 2 amino acid deletion in the spike protein. Now, the deletion was seen earlier in the virus that transmitted in minks in Denmark, because of which there was a culling of minks. But people don't believe that this deletion has much to do. However, the other two mutations, one is in a region which is called the receptor binding domain, against which neutralizing antibodies are primarily generated. And the second is in a region which is close to the cleavage, S1, S2 cleavage region. And both of these are likely to make the virus, make it more efficient for the virus to get into cells. So that's the scenario right now. It is for the first time that these two mutations have come together, and that is causing all this concern. Yes, UK is the only country that has reported large scale, but there are a few European countries, as Dr. Nanda also said, Australia, and maybe Dr. Vas tell us a little more about the Australian situation. So that's the situation right now. And I do agree that we should be concerned, but we should not be alarmed.
Okay, right. Many thanks, Dr. Shahid Jamal, for your opening remarks that we should be concerned but not be completely panicked or spooked by it. Professor Vasan, you represent CSIRO, that is a pretty well-known research and development organization in Australia. To begin with, sir, there have been few cases, of course, not in the quantum of how it's been reported in UK, but in Australia there have been few cases as well. So how important do you see, of course it's early days, but to understand this virus and how threatening it seems to be in Australia?
So yeah, I'll comment both on Australia and globally. I agree with Shahid ji in terms of what he said about not to be alarmed. This is an RNA virus, and viruses mutate. There's nothing alarming about that.
Right.
Unlike some other RNA viruses like the flu virus, this virus has what we call a proofreading mechanism. So it's a exoribonuclease mechanism. So it doesn't mutate as fast as the flu, for instance. Nevertheless, we published one of the first papers in the world back in March, April, on how this virus is evolving. And we predicted that something like this would happen, as did other groups as well. So the concept of accumulated mutations of interest is what Dr. Shahid Jamil was talking about. So this mutation comes at the back of the mink mutation that he referred to, which also comes at the back of another mutation known as D614G. So now what we are seeing is that these different mutations can sometimes accumulate, and particularly when they are in the spike protein close to or in the receptor binding domain, you will expect that something could happen in terms of transmissibility. There are, when I last did the analysis, there are 6 countries where we have seen that this mutation is currently there. I have to emphasize one thing. We are only tracking where public repositories have data, okay? So approximately for every 300 odd cases, one case, human case, they take the virus and they sequence the virus and they make it available in a public repository called GISAID. And there are other repositories like that. So we only know 1 out of those 300, okay? So, but that is still a very good indicator because you have, millions of cases at the moment. So if you look at whether this variant which has this mutation is growing faster than the wild type that doesn't have that non-variant, so to speak, 6 countries stand out. One is the UK, then you have the US, South Africa, then Brazil and Australia. So these are the 6 countries where we are currently seeing, and with the exception of Brazil, the other 5 countries currently seeing what we call a red spot, where it's outgrowing the non-variant. So this variant is growing much faster than the non-variant by 2 to 1. And that's happening in these countries, including in Australia. So it's of interest to us. We are monitoring, but we were also, my lab here was the first to publish experimental results backed by computer modeling. That the previous mutation we talked about, the D614G, similar mutation where it was speculated and shown as well that it's more transmissible, we did not find any major impact on vaccines. So I'm not unduly alarmed at this stage. I think it may result in cases, more cases, but it may, from vaccine perspective, I don't think it's going to have a major impact. But that's something, unless you test, you would not know for sure. So we are also currently involved in getting that tested, and that will take some time.
Right, right. Certainly, it'll take some time since it's early days, as we have been emphasizing the program. And of course, the thing here to consider is that it's spreading at a faster rate than how the usual, or you can say normal COVID or coronavirus has been spreading. That's what all the three experts have agreed to, and they've almost agreed to say that. Now, Dr. Raman Khedkar, let me come to you, sir. As you mentioned, and even our two other panelists, they also completely agreed that there is no need to panic at this moment. Now, as we discuss this program, the government of India has banned, they have restricted flights to and fro UK till December 31st. Now, you think that at least some quick measures need to be taken so as to keep the spread in check?
See, the measures are being taken in UK. The measures are also being taken in India. If you think in terms of UK, they have already went ahead and they said we would have tier 4 kind of a lockdown. So essentially it would mean they are not allowing this virus to spread as much as possible. Now at the same time, if we say that up to 31st of December we are going to have a flight ban from UK, to my mind there are two issues that will emerge. One, do we really know whether this virus is not present in India?
Okay,
Number
that's very
two,
important.
which is
That's very
also important for us to understand, is if at all, if we have to go for a travel ban, then a limited travel ban, and perhaps with a background that Christmas is coming, so people may be traveling more, and UK and India travel may be higher.
Yeah.
That must be the only logic with which it must have had been driven. But I think isolation for 14 days after, no, or those kinds of strategies will perhaps work better in addition, and we should be able to do that.
Right. So clearly, some measures need to be taken. An extremely important point that has been raised by, or rather referred by Dr. Raman Khedkar here, that do we really know if this strain is also present in India? Here, Dr. Shahi Jamal, now in terms to understand the virus, now if a strain is discovered several miles from a particular country, is there a possibility of a similar sort of a strain would be possible here as well? And given the virus is known to develop its strain or variant, as you just mentioned in your opening remarks.
Well, I mean, the virus will not fly by itself. The virus has to fly in a person. These flight restrictions are going to be useful. So let me go back a little and say that whatever data is available from India suggests that so far these two mutations are not seen together in India.
Okay.
The 681 mutation is already present in the country. It's been seen in the country. Okay. And the other prevalent mutation, the G614 mutation, more than 2/3 of the viruses in India are G614. On top of G614, we have the 681 mutation already in the country. We know that. But we have so far not seen the 501 mutation in the country. Now, the virus has to come inside a person. So the easiest way to track is to do better surveillance at airports.
Okay,
And
okay.
and I'm saying this because my son just flew in from US last
Okay.
week, uh, and there was no surveillance at the airport. There was utter chaos at the airport. No one knew what was going on.
Mm-hmm.
Uh, remember that is your easiest point of control. And
Mm-hmm.
a variant that is spreading in UK at this time,
Mm-hmm.
which has already gone to a few other countries, if you just restrict flights from UK, you're not
Mm-hmm.
going to be able to stop it.
Mm-hmm.
Maybe a person infected by this variant went to UAE and then is coming through UAE.
Mm-hmm.
Uh, so, you need to be more vigilant at airport. And I really think that India must implement uh, genetic sequencing more widely and use that as a tool of surveillance at airports. We really
Mm-hmm.
must strengthen that. This is a bad time for travel. Uh, Holiday season, as you yourself said,
Right.
uh, and we are getting very relaxed in this country, thinking that our first wave is down and the second wave
Mm-hmm.
is not coming. Uh, we need to be more vigilant uh, at points of entry. Just
Right.
restricting flights is not going to do it. We need to be more proactive and do more genetic sequencing.
Hmm. Absolutely, Dr. Jamal. We need to do a little more genetic sequencing as mutation itself means change in genetic sequence of virus. Now, that in itself opens up far larger ramifications here. Dr. Vasan, Professor Vasan, I beg your pardon. Let me understand with you. Does a change of genetic sequence of a virus, does it change D- does it also make any difference to how it hits our immune system?
Yeah, so first I will comment on the previous point raised by Shahid, because that's a very important point, and then I will answer this question. The previous point is that if you look at globally, and we did that calculation, I mentioned this to you previously, out of roughly 300 cases, only one case they actually take the virus and sequence the virus genetic information. It's only by sequencing the virus you can find out whether the mutation is in the country or not. So you asked a
Right.
very important question. Is this N501Y mutation, which is the most important of those mutations, is it there in India? It probably is there. We don't know. We can only know based on what we have sequenced. Globally, out of 300 cases, only one case is sent out for sequencing. But as long as you are doing that, you are likely to pick it up. So if you are doing it for a long time and you have lots of cases, statistically you are likely to pick it up if this particular mutation is there. The problem with India is we don't, that 300 I told you is the global average. In India, the average is 3,000. So which means for every roughly 3,000 cases in India, only one is sent out for sequencing. So we are actually doing 10 times less sequencing than the global average. Now, but we are also doing some things really well. Okay, I must say that in India we are also collecting patient information and making that available, which rest of the world is not doing as great. But in the context of incoming travelers, I would very much support what Dr. Jamil said earlier, which is we have to monitor all the incoming passengers. We should take nasal swabs and test for COVID. And also, when we find that they are COVID positive, we have to send those samples for sequencing. And there is fantastic facility now in Gujarat and other places. So you can actually answer that question which you raised, which is, do we know if it is coming into India? The other point which you raised is, will it affect if there is a mutation? Of course, that's what is being studied. It's very early days to see whether it is more transmissible or whether it is going to result in more severe disease and so on. At the moment, from what I have seen, there is no evidence that this particular variant is giving rise to a more fatal disease or a more clinically severe disease. Okay.
Right.
What we have heard from the British authorities is that it is likely to be more transmissible. And that we saw with the previous mutation, which is the D614G mutation as well. So that's not surprising. And in fact, my analysis is also picking up the same, that in the countries, the 5 countries, 6 countries I mentioned, where it is present, it's actually growing, twice as fast as the non-variant. So it's clearly something is happening there. But I do not believe, as I said previously, that it's going to affect our efficacy of the vaccines, particularly the Oxford vaccine, which is likely to be rolled out in India through the Serum Institute manufacturing it. I don't believe at this stage, from what I know, that that's going to be affected. But that's something with science, unless you experimentally prove it, you can't say anything for sure. So my laboratory is currently involved in that studies to once again conclusively establish that the vaccine efficacy is not going to be affected.
Right, right. Very important point. Dr. Ganga Kherkar, let me also ask you this, as Professor Basan just mentioned, that this strain of virus will not have any impact, or to say it will not affect the efficacy of the vaccines that we are making. Now, considering that the mutation itself means change in the genetic sequence, so I have a same question to you. So will it have any impact on the efficacy of the vaccine? Considering we are making vaccine for a particular virus, and then what if somebody is struck with the mutation, a mutant of the virus?
No, I don't think we need to be worried about that part.
Certainly we
One
don't
of
worry
the
much.
reasons one of the reasons is that all the so-called candidate vaccines that India is more likely to choose, they are using entire spike gene at this point in time. So there would be multiple epitopes, to which epitopes are those kind of things which will induce immune response. Now, since it has multiple epitopes, change in one of them is not likely to affect the vaccine efficacy as such. But if there are multiple epitopes that are affected, then things can be different.
That's
It is
important.
also important to recognize is we are not choosing any subunit vaccine. If we don't choose a subunit vaccine, perhaps the risk becomes far lower at this time point. So we should not be worried about vaccine and vaccine related efficacy. One of the key messages that we should carry is it would be good to start vaccine delivery program and try to end it up as rapidly as possible if we want to control this infection. Otherwise, these mutants that might come up can pose some degree of challenge.
That's very important. Now, Dr. Jamal, as you're about to close the program, and one very important question I have in mind here, as we have seen in last few weeks, the trend, or say the numbers of the COVID positive cases have come down on a fairly regular scale. So, will this mutant virus poses any sort of a change in that equilibrium, to say of?
Well, it firstly depends on how much of the mutant virus starts circulating in the country. I don't think, looking at data at this point, that is going to make much of an impact.
Okay.
But then viruses have this uncanny ability to prove all of us completely wrong. So I wouldn't bet against it. And my message would be, don't pay any attention to people like us talking on the television, telling you that the first wave is over and the second is not coming. Whether it's coming or it's not coming, whether a vaccine is there or not, continue to wear a mask, continue to maintain distance, continue your hand hygiene, and you must be doing this for the next year at least.
Okay.
I would say till the WHO tells us that the pandemic is over, this behavior should not change. Otherwise, no matter what you do, things might get worse. So don't think that once a vaccine is rolled out, everything is going to be hunky-dory. To continue to follow these measures.
Right. Professor Vasan, your closing remarks. I mean, how long you think, in your opinion, personal opinion, should we follow these COVID-appropriate behavior, and how important is it for the civic and the health authorities to be concerned about the spread of a new mutant virus? I know.
So
I mean,
I would
yeah,
entirely
please go
agree
on,
with
sir.
Shahid, because this should become a way of life where we, particularly given the Prime Minister's fantastic initiatives over the last many years with Swachh Bharat and trying to bring good hygiene and sanitation as a way of life in India. I think this is a great opportunity, and we Indians have a very positive mindset. So with every challenge comes an opportunity, and we should actually use this to springboard our public health promotion messages and to convince people that washing hands, having good hygiene, particularly after going to the toilets or other touching surfaces, or whether you're coughing, if you cough, with like this, so that you're not spreading, slicing. These should. Why stop with COVID? Even when the WHO says the pandemic is over, we should change some of the way in which we are our civic hygiene and sanitation practices. And this is, if the pandemic has brought one silver lining, it is that now everyone, the Aam Aadmi, is quite aware of these challenges. And I think this is a fantastic opportunity for India to also have that revolution in sanitation, which we missed out during the British rule. In places in the Western world, there was a huge sanitation revolution, which unfortunately India missed out on. And this is a great opportunity for us to catch up on that. And on the mutation itself, I will tell you this. This is exactly right. So we saw this D614G. We saw the MINC mutations last month. Now we see this 501Y. So we will see this again and again. Okay, so there is nothing to be entirely panicking about that. What is really important is it's only a matter of time, unfortunately, that this mutation will find its way to India. We can't totally control this, okay? What we can do is, when the vaccine is rolled out, to follow these hygiene procedures to fight this virus. And let's also not forget, many of the vaccines, including the Oxford AstraZeneca vaccine, only protects about 6 to 7 out of 10 people, right? So there is still the problem. The efficacy of the vaccine is only, at the moment, 60% to 70%. They are now trying to improve it to 90%, but that still leaves some people who might have received the vaccine but still unprotected. So what Dr. Jamil said is really critical, that we have to do our civic duty and continue to wear masks, continue to be careful till we can completely stamp this virus out.
Right. Dr. Professor Vasan, many thanks for joining us. Dr. Shahid Jamal and Dr. Aman Ganga Kherkar. Sir, many thanks for joining us, and extremely insightful to hear all your opinions. Now, before we leave you, here's a small appeal by RSTV to all our viewers. Help defeat coronavirus pandemic. Please follow COVID-appropriate behavior. Keep wearing masks. Keep washing your hands. 20 seconds at least, that's what the expert says, and follow physical distancing guidelines. Remember, these are things that can help you defeat this pandemic. Well, many thanks for joining us and watching this show on RSTV. Keep watching RSTV and stay safe. Goodbye.